is very, very important. Then we start with chronic inflammation. We finished about acute inflammation, and the acute inflammation is distinguished by vascular changes, inflammatory exudate or edema formation, and neutrophil infiltration. This is acute inflammation. A chronic inflammation is defined as inflammation of prolonged duration. It takes weeks, months, or years. ممكن أن يأخذ سنوات خصوصا TB, tuberculosis. And it is characterized by the following histological features. This is the features of chronic inflammation, which are differentiated from acute inflammation. First, the chronic inflammatory cell infiltration, mononuclear cell, which include lymphocytes, macrophages, and plasma cells. These are called mononuclear cell. Why mononuclear cell? Then they have single nucleus or nuclei. ممكن النيوتروفيل nucleus مالتها lobulated. Single nucleus. So it is called mononuclear cell. يعني الكرونيك inflammatory cell هي mononuclear cell, lymphocyte, macrophages, and plasma cells. And the infiltrate is polymorphic. What is mean polymorphic? Many types of cells. While in acute inflammation, monomorphic, single type, only infiltration. In chronic, polymorphic, many types of inflammatory cells, as a nshوفها macrophage, lymphocyte, and plasma cell. Second, there is tissue destruction and there is tissue damage and destruction, which is induced by the products of an inflammatory cell. These chronic inflammatory cells produce chemical mediators, especially cytokines. Cytokines, the tumor necrosis factor with interleukins, causes destruction of the tissue. Third, almost always healing in the chronic inflammation by fibrosis and scar formation. يعني there is no regeneration. النسيج الثالث ما يعوض نفسه بنفسه، وإنما يتعوض بالفايبرس tissue في chronic inflammation. Usually, the healing only there in chronic inflammation by fibrosis and scar formation. It is started by angiogenesis. مثل ما قلنا angio means blood vessels, genesis proliferation of blood cells. Start by proliferation of new blood vessels by process of angiogenesis and fibroblast proliferation. هذا النسيج نطلع عليه granulation tissue. Gradually, granulation tissue mature and converted into dense fibrous tissue with scar formation. Fourth, chronic inflammation is productive in nature. What is mean productive? Means there is production of granulation tissue, which is a tissue of healing. Healing starts by granulation tissue formation. Healing يبدي أول granulation tissue. يعني there is a production of a new tissue. It is not exudative. يعني there is no exudate formation in chronic inflammation. Exudate formation only feature of acute inflammation. There may be foci of suppuration. ممكن احنا قلنا suppuration هو features of acute inflammation due to the biogenic bacteria. Sometimes there is a chronic suppuration with the chronic abscess formation, especially in the bone. البون نعرفه انه hidden organ, not visible to eye, ما حد يشوفه. فممكن ان يصير به acute inflammation, especially in children, and convert into a chronic. Start as acute abscess without treatment, converted into chronic abscess. And the last feature, which is very, very important, is the granuloma formation. That will be discussed later. Okay? أكو أي سؤال واضح؟ This is the features of chronic inflammation. At the same time, it is also the histological features. How chronic inflammation arise? شلون يتكون chronic inflammation? Either from progression of acute inflammation into chronic inflammation, as due to the persistence of the positive agent, or it may be developed or start ab initio or de novo. هذه كلمات لاتينية. ab initio or de novo معناتها شنو؟ From the start, it is a chronic inflammation, which is the most common. يعني chronic inflammation arise ab initio or de novo from the start, more common than chronic inflammation from a progression of acute inflammation. واضح؟ لأن أن يكون progression of acute inflammation or start de novo. De novo or ab initio كلمات لاتينية معناتها تستart. Chronic inflammation مثل ما ذكرنا following acute inflammation due to the persistence of the causative agents. Example, شلون persistence of the causative agent? Inadequate to the range of abscess مثل ما قلنا. مثلا bone abscess or emphysema of the fluid. Inadequate to the range, remaining pus راح يتحول يصير chronic. Presence of the foreign body. شلون يدخل الفورن body إلى الجسم؟ especially in the road traffic accident, حوادث الطرق والسيارات, pieces of the glass, door, dirt may enter to the wound in the skin and present as a foreign body. Or suture material. Sometime after surgical operation, the suture material does not absorb by the body. عادة احنا خيوط العمليات تصير بها absorption اللي تتخيط بها الانترنال organ مو السكين. الانترنال organ يصير بها absorption. Sometimes not absorbed due to bad quality or expired. That remains and present as a foreign body predisposed to chronic inflammation. Third, a repeated attack of chronic inflammation, as in the presence of the gallstone in the chronic cholecystitis. Patient has gallstone. The first attack of inflammation راح يكون acute inflammation. Acute inflammation subsides after 2 or 3 months. There is a repeated attack. يعني الستون موجودة. So there is a repeated attack. And so on. A repeated attack of acute inflammation due to the presence of the causative agent, as in the presence of the stone in the gallbladder. It is called chronic cholecystitis. مفهومة؟ هذه يعني chronic inflammation result from a progression of acute inflammation. Second, in the chronic inflammation ab initio or de novo, it is start as chronic inflammation. And due to that, what? Why? This is from the beginning a chronic inflammation. Due to the following causes and the following condition. First, persistent intracellular infections, such as viruses, tuberculosis, syphilis, parasite, and fungal infection. These microorganisms, when infection occurs by these microorganisms, there is intracellular infection that cannot be eradicated easily. Second, immune-mediated inflammatory diseases. Diseases due to the immune mechanism, such as autoimmune diseases. All autoimmune diseases are chronic disease. You know what is meant by autoimmune disease. The body forms antibody against on tissue antigen. الجسم يكون مضادات حيوية ضد الأنسجة والخلايا مالته. فهذا هو الأوتو إميون. الأوتو إميون ديزيز ما ممكن أن يتوقف، ما توقف باقي. فإذا chronic inflammation such as rheumatoid arthritis, systemic lupus erythematosus or SLE, psoriasis ذا الصدفية بالسكن, and ulcerative colitis. Ulcerative colitis, it is immune-mediated disease of bowel. It is a chronic inflammatory bowel disease. Ulcerative colitis. So these are autoimmune disease. The allergic diseases such as bronchial asthma. أبو البرونكيال asthma تروح من عند البرونكيال asthma؟ لا. So due to the inhalation of antigen that cause bronchial asthma. The bronchial asthma يعني allergic disease. Some allergic diseases are chronic diseases due to the immune-mediated infections. Third, prolonged exposure to non-degradable toxic materials. This is occupational diseases. تعرفون شو معنات occupational diseases? Diseases that occur in the workers in the factories. يعني تحصل عند العمال والذي يشتغلون بالمعامل because of inhalation of some material such as inhalation of silica. Silica مادة الرمل يستخدموها بصناعة الأنابيب أو فتشي. The inhalation of silica particles تسبب لنا chronic disease in the lung called silicosis. Also asbestos مادة الأسبست تعرفونها. Inhalation of asbestos causing chronic inflammation in the lung called asbestosis. And also asbestos may cause bronchogenic carcinoma, lung cancer. All endogenous material. This is exogenous material. Inhalation of exogenous material. All endogenous material, such as lipid or cholesterol crystal deposit in the wall of the arteries, causing atherosclerosis with a chronic inflammation in the wall of arteries. These are the example of chronic diseases of initial. From the start, they are chronic diseases. أي سؤال؟ واضحة مفهومة؟ أخذنا acute نعرف morphologic pattern of acute inflammation. We come to the morphologic pattern of chronic inflammation which are variable and include the phenomena. First, chronic ulcer. يعني chronic inflammation may present as chronic ulcer. So, ulcer is a morphologic pattern of acute and chronic. We have acute ulcer and we have chronic ulcer, depending on the causative agent. Example, of chronic peptic ulcer. Second, discharging sinus, such as discharging tubercular sinus in the neck. Patient has cervical lymph node with the tuberculosis, TB of cervical lymph node. Without treatment, the caseous material discharged into the surface of the skin, forming sinus. The sinus is defined as abnormal tract connect between this body surface or the skin and underlying tissue or structure. It is an abnormal tract. Mention abnormal tract connect between the skin or body surface and underlying tissue or organ. In cases of tubercular sinus in the neck, the sinus connects between the skin and underlying lymph node. The lymph node شنو بيها؟ tuberculosis with caseous necrosis. بس راح يصير discharging of the caseous material to the skin. في الساينس تفسيرها بالعربي J. One end is open, other end is closed. This is the skin or the surface, and this is the tissue, underlying tissue or the. Okay, so this is the sinus. حتى to differentiate it from fistula. Other example of chronic discharge of sinus, chronic osteomyelitis. Example, chronic osteomyelitis of tibia. التيبيا تعرفوها قريبة على السكن. The bone of the tibia قريب على السكن. So any chronic inflammation of the bone with chronic abscess formation عشان ينفتح على السكن. فيصير discharging sinus in the ear. مفهوم الساينس؟ discharging sinus. Third, fistula formation. What is meant by fistula? It is also abnormal tract connected between two hollow organ or tubular organs, and both ends are open. Okay, fistula هي abnormal tract connected between two hollow organs, يعني organ من جوا, or tubular organs. Both ends are open, such as in a perianal fistula connected between anal skin and underlying muscle. Also, عندنا intestinal fistula connected between the loops of the intestine or between the large intestine and the small intestine. فالفرق الفistula عن الساينس, الساينس one end opened to the skin والother end closed. الفistula both ends are open. fistula ممكن أن تنفتح على السكن, ممكن أن ما تنفتح على السكن between the internal organs. مفهومة؟ Example also, tracheal esophageal fistula in the newborn. أكو بعض الأطفال من يولد أول ما ياخذ نقول حليب رأسا يصير عنده اختناق suffocation واسفكسيا يختنق من أول قطرة حليب ياخذ. ليش؟ أكو fistula connected between the trachea and esophagus. وياخذ عن طريق الاسوفاجس اللمب فراح وين يروح؟ التراكيا رأسا. فهذا رأسا يشخص هذا عنده congenital طبعا congenital tracheoesophageal fistula. فالفستula ممكن أن تكون between the skin and underlying tissue or organ or between two internal organs. The fourth feature, diffuse thickening of the wall of the hollow or tubular organ, such as in a chronic cholecystitis. When there is a tubular organ or hollow organ such as gallbladder or bowel, that there is diffuse thickening. Why? Because of chronic inflammation healing by fibrosis. The same fibrous thickening in the wall of the hollow or tubular organ. Fifth, chronic abscess. As we said, abscess may be a feature of acute inflammation as acute ulcer, abscess, or chronic inflammation as chronic abscess. 6. Stenosis and structural formation of a hollow or tubular organ. Why? ليش؟ Mr. ذكرت because of healing by fibrosis. Healing by fibrosis causing narrowing and obstruction in the lumen of hollow or tubular organ, such as the bowel, and cause intestinal obstruction. And the last feature is granuloma formation. As we said, granuloma formation will be discussed later. Is there any question about the morphology? جاي يشوفون إن بعض المورفولوجي جاي يشترك الأكيوت والكرونيك، هي الألسر والأبسس. ممكن أكيوت وممكن كرونيك. This is the morphology, gross morphological pattern of a chronic peptic ulcer or chronic duodenal ulcer, where this is ulcer, and we define ulcer as a local defect in the mucosa or in the wall of the duodenum. This is duodenum and this is duodenal ulcer. Start as acute ulcer. Repeated attack become chronic ulcer. This is stomach with the chronic gastric ulcer and complicated with perforation. You see, there is perforation in the wall of the stomach. This is amputation of lower limb of diabetic patient. And this patient has a chronic diabetic ulcer at the lower leg. This is ulcer. In addition, there is gangrene. There is gangrenous inflammation in the foot. But it should be treated by amputation. And an amputation at the level of healthy tissue. Why healthy tissue? Because gangrenes propagate, separate. This is also diabetic patient with the chronic diabetic ulcer in the sole of the foot. Chronic ulcer in the sole of the foot. This is also diabetic patient, diabetic ulcer. This is gallbladder followed by stone with the diffuse fibrous thickening in the gallbladder wall. And this is a numerous stone involved with the gallbladder tract. But this is a chronic cholecystitis. This is the sinus. This is the abdominal wall. And this opening of the sinus, it is a chronic sinus. This patient has a Crohn's disease. What is a Crohn's disease? Crohn's disease is also immune-mediated chronic inflammatory bowel disease. يعني Crohn's disease والulcerative colitis are immune-mediated disease, chronic inflammatory disease of small bowel of unknown etiology. ما معروف السبب معناته. It is immune-mediated diseases. ليش تصير؟ etiology. This patient has a Crohn of small bowel. And the sinus tract connect between the small bowel and the surface of the abdominal wall, or to the skin of the abdominal wall, and discharge the bowel content. يطلع من opening of the sinus the content of small bowel. But this is the sinus. This is a tuberculosis or granuloma formation in the lung. But this is lung tissue, and this is hilar lymph node. But this patient has tuberculosis with the granuloma formation in the lung and in the higher node. Okay, we come to the types of cells in chronic inflammation. As we said, chronic inflammation has polymorphic infiltrate, many types of cells. The most important are first lymphocytes. They are the main cells in the chronic inflammation. You know, lymphocytes of two types, T cell and B cell. T lymphocyte and B lymphocyte, which are the cells of immune system. T lymphocyte responsible for cell-mediated immunity and secrete cytokines. When activated, T cell responsible for cell-mediated immunity, which is a type 4 hypersensitivity reaction. And activated T cell produce cytokines, which is very important in chronic inflammation, cause destruction of the tissue. B lymphocyte, as you know, are responsible for humoral immunity, means production of antibodies, which are immunoglobulins. Activated T lymphocytes produce cytokines, which are interleukins and the tumor necrosis factor والانترفيرون جاما. فذكرنا بالمحاضرات السابقة أنه الانترفيرون جاما more important in chronic inflammation. فشو يسوي الانترفيرون جاما؟ activation of macrophages and fibroblasts. يعني شنو أكو بالchronic inflammation؟ أكو destruction of the tissue أو أكو fibrosis. Second, macrophages. Also, most important and dominant cells of chronic inflammation. They are derived from monocytes, circulating monocytes. In the blood are called monocytes. In the tissue are called macrophages and histiocytes. The same meaning. They are activated by interleukins, tumor necrosis factor, endotoxins, and interferon gamma. The activation of macrophages, it has become actively phagocytic cells. نعرف إنها الماكروفاج هي powerful phagocytic cell, phagocytes. Normally, there are 3 tissue histiocyte or macrophage. In our body, normally there are 3 tissue histiocyte or macrophage. Why is called the 3? Because they are scattered diffusely within the loose tissue, such as pleura, peritoneum, or loose tissue. And we have fixed tissue histiocyte. مثل ما أنتم ماخذيها بالهistology. Fixed tissue histiocyte يعني ثابت. Such as in the sinusoids of the liver, نطلق عليها, they are called Kupffer cells. In the spleen, in the bone marrow, in the lymph nodes are called sinus histiocytes. In the bones are called osteoclasts. In the brain are called microglial cells. And in the lungs are called alveolar macrophages. I normally present as fixed tissue, as one component of the normal tissue. Or what are the functions of macrophages in chronic inflammation? The most important function is phagocytosis, which are powerful phagocytic cells. Then neutrophils, phagocytes, neutrophils, and macrophages. The powerful macrophages. Second, secretion of an inflammatory previously. Lysosomal enzymes, all called proteases, nitric oxide, oxygen free radicals, cytokines, vascular permeability factor, chemotactic factor, endogenous pyrogene, which causes fever, and secretory growth factors, which are factors stimulate the proliferation of fibrosis or fibroblast to produce fibrosis and also angiogenesis, stimulate or induce angiogenesis. And the third function, antigen processing. What does it mean? Preparing the antigen to immune system for immune stimulation. يعني تحضر الانتيجين، تطبخ وتحضر الانتيجين للاميون سيستم حتى يحصل immune response against this antigen, the formation of antigen. So the function of macrophages in chronic inflammation are different from acute inflammation. وظيفة الماكروفيج بالchronic تختلف عن الأكيوت. In acute inflammation, that is the cone, in acute inflammation, macrophages appear after 24 to 48 hours. تظهر بعد يومين أو أكثر. شنو وظيفتها؟ Scavenger cell, powerful scavenger cell. They are responsible for the clearance of the tissue from the necrotic and cellular debris. النيكروتيك tissue cellular debris منين اجت؟ Because of neutrophils. In acute inflammation, neutrophils cause destruction of the tissue, followed by macrophages. They are responsible for clearance of the site of inflammation by phagocytosis. While in chronic inflammation, the macrophages causes destruction of the tissue with fibrosis. Okay, مفهومة؟ And they are persist in acute inflammation in macrophages after clearance of the area or the site of inflammation. They die and removed by lymphatic to the regional lymph node. But in chronic inflammation, macrophages persist and increase in accumulation with that تجمع because they are cause tissue destruction and fibrosis. These separate fibrosis and they secrete both factors. Proliferation of fibroblasts and blood vessels. ليش يسبب tissue destruction؟ لأن secrete lysosomal enzyme, nitric oxide, oxygen free radicals, cytokines. Okay, مفهومة؟ The function of macrophages in acute inflammation differ from a chronic inflammation. This is the picture of a chronic inflammation. This is lymphocyte. Lymphocyte هذا قلنا هي mononuclear, single nuclear. تشوفون هاي الليمفوسايت وهاي هي الماكروفيج. Single nuclear. Lymphocyte has round hyperchromatic nuclei or nucleus with scant cytoplasm, little cytoplasm that cannot be seen in the tissue section. في السلايد ما نشوف السيتوبلازم، فقط نشوف النيوكليوس. هاي بالنسبة للليمفوسايت. وهايبركروماتيك يعني دارك ستين. While macrophage, the nucleus is irregular, kidney shape تشبه شكل الكدني or bean shape تشبه حبة الفاصوليا. bean shape with abundant cytoplasm containing particles which are phagocytosis particles. نلتهمتها فتظهر بالسيتوبلازم. فنطلق عليها monocyte in blood and tissue, histiocyte or macrophage. That's it. The third important cell of chronic inflammation is plasma cells. Plasma cells, they are responsible for production of antibody against antigen. And they derived from B lymphocytes. منين الأوريجين مالت البلازما سيل؟ هي البي lymphocyte. تتحول إلى plasma cell to produce antibodies or immunoglobulin. شكل البلازما سيل هاي جاي يشوفوها it has round eccentric peripheral nucleus peripheral eccentric nucleus or peripheral with coarse chromatin and cartwheel distribution مثل العجلة. عجلة مالت البايسكل شلون؟ مخططة. فهذيك تصير الكروماتين of the plasma cell like cartwheel distribution. And abundant bluish cytoplasm. Abundant bluish cytoplasm. فهذا شوفوا البلازما سيل. نيوكليوس واحد وهذا كلها مونونيوكلير سيل. أغلبية. Sometimes other cells are present in the chronic inflammation and depending on the causative agent or depending on the causative agent. And then eosinophils are commonly seen in the parasitic infection and allergic condition. When there is allergic condition or there is parasites in the tissue, chronic inflammatory cells are mainly eosinophils. شنو وظيفتها؟ They secrete major basic protein which are toxic protein killing the parasite and also at the same time causes tissue necrosis or tissue destruction. هذا الميجر basic protein. هاي وظيفة الإيوزينوفيلز. جاي يشوفوها الإيوزينوفيل هي bilobed nucleus. Bilobed nucleus. Abundant eosinophilic granules, red granules. And the last cell, mast cells are common in the allergic reactions and also in the anaphylactic shock. And the function of mast cell release histamines. And histamines responsible for vascular changes that occurs in the allergic reaction and anaphylactic shock. بعدين تلاحظون the types of shock in the circulatory distress. Okay? مفهومة؟ Thank you very much for your listening. This is the 6th lecture. And we start with the 7th lecture.